I'm an estate planning attorney. Today we be talking about something that many people do and like to think about but need to have in place. That is what happens if they become incapacitated or unable to make decisions for themselves. In order to plan ahead so you can rest easy knowing that your wishes will be carried out, even if you can't communicate them. There are a few important documents that you should have in place. The first is a health directive. The second is a power of attorney. The third document is a living will. Now, those documents sound very similar, and they all work together. They're all part of your overall estate plan. But each one serves a different function. It's important that you understand what each one is because you want to make sure that you have these in place to cover all of your bases. Let's start with the health directive. Now, this is also sometimes referred to as a healthcare directive or an advance directive. Its purpose is to allow you to provide instructions about your future medical care. If you become incapacitated and unable to communicate your wishes, now, there are two types of health directives. The first is a living will. We'll talk about that in just a minute. The second type of health directive is a durable power of attorney for healthcare. This allows you to appoint someone you trust, such as a family member or friend, to make medical decisions on your behalf if you become incapacitated. For example, let's say you're in a car accident and you're unable to communicate. Your doctor might be faced with a situation where they need to make a difficult decision regarding your treatment. Maybe there's a surgery that needs to be performed, but you haven't given them consent to perform that surgery because you were in a car accident and you were unconscious. Well, with a durable power of attorney for healthcare in place, your doctor can turn to the person you designated in that document and say, I need to perform this surgery. Can I do it? And then that person can say, yes, I am your agent. You can perform the surgery. So that allows you to essentially speak through your agent, even if you were unable to communicate for yourself. The second document is a living will. A living will allows you to spell out your wishes regarding certain types of medical treatment. It becomes effective when you're unable to communicate for yourself, perhaps because you're in a coma or you have a terminal illness. There are some situations where doctors sometimes ask patients whether they would want life-sustaining treatment, and that could include things like mechanical ventilation, dialysis, or artificial nutrition and hydration. With a living will, you can spell out your wishes so that your doctors and your loved ones know what you want. Do you want to be kept on life support? Do you not want to be kept on life support? Do you want to be kept comfortable, but allowed to pass away naturally? Those are the kinds of things that a living will can cover. A living will does not cover all medical decisions. It only covers those types of life-sustaining treatment decisions that we talked about. If you have other wishes regarding your medical care that aren't covered by a living will, you should consider putting them in a durable power of attorney for healthcare. Again, that's the document that appoints an agent to act on your behalf if you become incapacitated. Now, the important thing to remember about these two documents is that they work together. Having both a durable power of attorney for healthcare and a living will in place gives you more comprehensive protection. The durable power of attorney allows you to give someone else authority to make all types of medical decisions on your behalf. And the living will allows you to spell out your wishes regarding certain types of life-sustaining treatment. Together, they help ensure that your medical wishes will be carried out, even if you can't communicate them. You should also remember that you can always change your mind. If you decide that you want to change your beneficiaries, or you want to change your agent, or you want to revoke these documents altogether, you can do that at any time while you're still competent. Now, once you've made your wishes known through these documents, it's important to make sure that your loved ones and your doctors know where they are and that they know how to access them. Make sure you store these documents in a safe and accessible location, perhaps in your home or with a trusted friend or family member. You may also want to consider using a safe deposit box or online storage, just as long as your doctors and your loved ones know where they are. Now, the last thing I'll mention about these documents is that they're state-specific. Each state has their own laws about what must be included in a power of attorney or a living will for it to be valid. It's important that you make sure you use the right forms for your state. You may be able to download forms for free from your state government website. Or you may want to consider using an online legal service. That way ULL have the peace of mind knowing that your documents are set up correctly and that they follow the laws in your state. Now, there are two major downsides to using an online legal service. First, it may not be as affordable. You'll have to pay a fee. It may be a few $100s to set up your documents. And secondly, it's not personalized. It's not specific to your individual circumstances. If you would like to learn more about setting up your documents the easy way, check out my complete estate plan. With our complete estate plan, not only do you get professionally prepared legal documents that follow the laws in your state, but you also get the benefit of an estate planning attorney reviewing your answers to make sure that the plan that you re-getting is right for you. After all, everyone's circumstances are different, and an online legal service cannot account for every single possibility, but we can. If you'd like to learn more about our complete estate plan, click on the link below. Moving on to the next type of directive, which is a power of attorney. Now, unlike a health directive, which focuses on making decisions about your medical care, a power of attorney allows you to give someone else authority to make decisions on your behalf regarding your financial and legal affairs. A power of attorney can be helpful in a variety of situations. For example, if you re-going on vacation and you need someone to take care of your bills while you re-gone, you can give them a power of attorney. That way they can pay your mortgage or your rent, they can pay your utilities, they can take care of those things for you while you're on vacation. Or if you become incapacitated and are unable to manage your own affairs, a power of attorney allows you to give someone else that authority, so that person can continue paying your bills, managing your investments, and taking care of your other financial matters. Now, just like with a health directive, you can give someone limited authority to handle specific tasks on your behalf. For example, you can give someone the power to sell real estate or manage your bank accounts. You can give someone broad authority to make all types of decisions regarding your financial and legal affairs. Now, there are several different types of power of attorney. Two of the most common types are a durable power of attorney and a springing power of attorney. A durable power of attorney remains in effect even after you become incapacitated. A springing power of attorney takes effect only after you become incapacitated. Now, which type of power of attorney is right for you? That depends on your individual circumstances. If you have a trusted friend or family member who you want to give broad authority to make decisions on your behalf, if you become incapacitated, a durable power of attorney may be a good option. However, if you want to give someone authority to make decisions on your behalf, but you want to make sure that they only take over those responsibilities if you become incapacitated, a springing power of attorney may be a better option. Again, everyone's circumstances are different, so it is important to talk to an estate planning attorney to determine what type of power of attorney is right for you. Finally, we come to the last document in this video, and that is a living will. We talked about this briefly when discussing the health directive, but now let's talk about what a living will is and why it's important. A living will is a document that allows you to spell out your wishes regarding certain types of medical treatment if you become incapacitated. A living will typically only covers decisions about life-sustaining treatment, such as mechanical ventilation, dialysis, or artificial nutrition and hydration. Now, why is a living will important? Well, without a living will, your loved ones and your doctors may not know what you want if you become incapacitated and unable to communicate your wishes. A living will helps ensure that your wishes will be followed, even if you can't communicate them. Now, in addition to completing a living will, it's also important to discuss your wishes with your loved ones and your doctors. That way, there's no confusion about what you want if you become incapacitated. Now, a living will is a very important document, but it's only one piece of the puzzle when it comes to planning for the future. If you also have a health directive and a power of attorney in place, you'll have a comprehensive plan that addresses all aspects of your care if you become incapacitated. Now, like we talked about earlier, a health directive and a power of attorney are separate documents that work together to give you comprehensive protection. So make sure you have both of them in place. By planning ahead and putting these documents in place, you can rest easy knowing that your wishes will be carried out, even if you incommunicate them. So please make sure that you don't procrastinate. Take the time now to put these important documents in place so that you and your loved ones will thank you in the future.